Probably one of the most frequently misunderstood problems that people come in with is that they think they need a scan to see what's going on. I'm going to demonstrate in the next 60 seconds why there's every probability that you won't need a scan if you've got sciatica. Let's take a look at this table. Now, this table, if you stay with me for a second, was taken from a study that was conducted in 2015, published in 2015. And what they did is they took a group of asymptomatic individuals. Now, what that means, of course, is that they had no symptoms at all, and they MRI scanned them. They then classified them according to their age. So along this part is their age from 20s to 80s. They were classified according to age. And then they documented any degenerative changes, any particular findings on the scans that they saw. And that's in this column. So disc degeneration, disc problems, disc protrusions, facet joint degeneration, things of this nature that are commonly given as people's diagnosis of their problems. Now remember, this study was taken from people who had no symptoms whatsoever. And what we can see is that as age increased, so too did the prevalence. These are percentages. So 93% of people in their 70s had disc degeneration. And all of these basically increased with age, much the same as getting grey hair, or in my case, no hair. These were changes that actually occurred naturally. These people had no symptoms. So imaging does not equal causation. And what we mean by that is that just because there's changes potentially on your structure, like disc protrusions or disc bulging or degenerative changes, it doesn't necessarily mean that it is causing your symptoms. It's a bit like if I was to put my hat on and it started raining, that isn't the cause of why it started raining. If I had the power to turn the rain on and off using the power of my hat, I would definitely take it off and let the sunshine come out. But as it is, I live in England and it rains all the time. So therefore, it's a fantastic demonstration of why it's not possible from a scan to see exactly the cause of your symptoms. So why do some professionals do X-rays and MRI scans as a diagnostic for these kind of problems? Well, there's all sorts of reasons for that, but I can tell you that this is completely false when it comes to giving information about exactly what's causing your problem. In fact, it's often unhelpful because if you tie yourself to a diagnosis, it can actually limit your beliefs in terms of your ability to get better. It can limit your motivation, and it can increase negative feelings that can also therefore increase your pain problems. You can get stuck in a rut. I see this all the time with people who have been told years and years ago that they have a bulgy disc, but continue to get symptoms. And then lo and behold, when I've explained these things to them, we've got things moving, they've actually got better. And they think, why did I go all those years believing the structure was the problem? And actually, it was the movement problem that could be corrected through following a series of principles of exercises, movement as medication. Did you know only 5% of spinal problems actually have a specific spinal pathology, an actual specific diagnosable problem? That means 95% of problems are non-specific and very difficult to explain. So we have to follow principles, and this is where MRI scans are not that useful to show us. Now, there are a couple of reasons why people should have MRI scans, and that is if you have specific symptoms which need to be investigated to make sure that you don't have anything more serious. These symptoms include cauda equina symptoms, which are basically where you have a loss of bladder and bowel function, a loss of control. You can have numbness around your bottom, which is another sign that you have considerable problems related to a spinal cord compression, and also where you can have a progressive loss of limb strength. And this is where it gets worse and worse. This is where you can have potentially both legs are lost in terms of their ability to move. These are serious problems that need investigation. Thankfully, they're incredibly rare. And so if you have those symptoms, it warrants an immediate MRI scan. If you do not have those symptoms and there's no history of things like cancer or other problems, other symptoms that mean you suspect there might be something more serious going on, like feeling a persistent unwellness or loss of weight unexplained, then basically you're not likely to need a scan. And so let's dispel the myth that a scan is going to show you exactly what is going on with your problem. The human body is much more complex than that. And there's a complex interaction between the head and the physical. And with the way that people move differently between individuals, this is where movement helps. Now, another instance regarding x-rays is if you have had a fall, if you've had a trauma onto an area and that has been the onset of your problems, then in that case, especially if you are an older individual, or especially if you have a history of osteoporosis, which is a bone thinning disease, that makes you a little bit more susceptible to fracture. You want that fracture to be ruled out. So in that context, an x-ray is useful, but it's very much based on the history of the problem. And if something has come on spontaneously without a particular traumatic cause, then it's unlikely that you would need an x-ray, or indeed that the x-ray would show you anything of any great interest. Now, the only real incidents when I recommend having a scan and you don't have those serious symptoms is when it's related to a long history of chronic symptoms that are not getting better, potentially getting worse in terms of pain, and they have not responded to conservative treatment like exercise and manual therapy, things like that. And if they haven't responded and they're feeling like they're getting worse and worse, then in that context, sometimes it's worth sending them for a scan to make sure we've not missed anything in terms of a serious pathology. And sometimes the scans can give us indications about maybe if someone might benefit from a surgical procedure. So there you go. If you go to see a therapist and they say to you, we need to do an x-ray or an MRI scan to see what's going on so that we can then decide what treatment to do, that is nonsense. And please find somebody who actually knows what they're doing.